I moved around a lot as a child. I'd gone from Chicago to Kansas City to a small town in Nebraska, and I graduated from high school from Nebraska. Went undergraduate to Lincoln Medical School in Nebraska, and then residency and fellowship at the University of Kansas. Stayed there on faculty for 5 years and moved to Sioux Falls and have been there ever since. Drawing me to medicine, I really enjoyed the challenge, first of all, but I also love the idea of helping others. As far as psychiatry, I really had an interest in pediatrics, but I also enjoyed psychiatry. So child and adolescent psychiatry was always my end goal, so I really knew going into psychiatry I'd go do a fellowship in child and adolescent psychiatry. And I really liked the idea of working with children. I love kids. I think there's a preventive quality to working with children, and maybe you can help them when they're younger so that they don't have problems when they're adults. I love the fact that you get to spend time with patients too. In psychiatry, you get to spend a lot of time talking to people. I really enjoy that interaction. I think when you do child, you treat the family as a whole. So you really, you want to get to know parents and the kids and really work kind of as a team. And yet you also want the children, even though they're minors, to have some say in the treatment, even if they're younger, at least have them agree with what we're doing, explain why we're doing it. So really involve them in the care also, despite maybe a younger age. I'm glad to be part of the Avera team. So with their long-standing history in psychiatry in this area, I think there's some opportunities to work on some innovative programs, especially in the area with the shortage of psychiatrists. They're looking at some different models to really help try to sort of improve the access to psychiatric care. With the teaching program at Avera, I've always enjoyed the educational approach to educational aspect of teaching residents. So I think I'll be more involved with teaching with the residents while I'm at Avera too. I have lots of hobbies. I like spending time. My wife and I love the outdoors, so we hike, we go biking. I'm a new grandfather, so we're loving to obviously enjoy visiting our families. I do have a guitar. A couple guys I play guitar with every Thursday evening, so I really enjoy that too.